there's something that I'd like you to see.
It's a story that's deeply unsettled millions in China. Footage of a 2-year-old girl hit by a van and left bleeding in the street by passers-by. Footage too graphic to be shown. The entire accident is caught on camera. The driver pauses after hitting the child, his back wheels seen resting on her for over a second. Within 2 minutes, 3 people pass 2-year-old Wang Yu by. The first walks around the badly injured toddler completely. Others look at her before moving off.
There were other people who walked past Wang Yu, and a second van ran over her legs before a street cleaner raised the alarm. She was rushed to hospital, but it was too late. She died. I wonder how many of you, looking at that, said to yourselves just now, I would not have done that. I would have stopped to help. Raise your hands if that thought occurred to you. As I thought, that's most of you. And I believe you, I'm sure you're right. But before you give yourself too much credit, look at this. UNICEF reports that in 2011, 6.9 million children under 5 died from preventable poverty-related diseases. UNICEF thinks that that's good news because the figure has been steadily coming down from 12 million in 1990. That is good. But still, 6.9 million is 19,000 children dying every day. Does it really matter that we're not walking past them in the street? Does it really matter that they're far away?
Altruism can take place in many forms and is not inclusive to charitable donations, but it is a general concern for the well-being of others. There are many charities that are truly altruistic and have good intentions, but it can be difficult to discern what charities have ulterior motives or to discover how cost-effective these charities truly are. World-renowned Austrian philosopher Toby Ord, who is also the founder of Giving What We Can charity, has developed several research papers indicating the importance of cost-effectiveness in relation to global health. Health interventions have varying degrees of efficiency throughout the developed and non-developed world, and it is vital that a charity budget is spent to improve the well-being at a maximum efficiency. The disease control priorities have analyzed 108 different health interventions and found that some interventions are nearly 1,400 times more economically effective than others. An effective intervention is the surgery to reduce the effects of blindness through trachoma, which has an overall cost of less than $20 per patient cared in Africa, but only one seeing eye dog in the United States has an overall cost of $40,000 with the required training for both dog and owner. There are many other examples of cost-effectiveness in relation to world health, and it is noteworthy to examine how much more effective these interventions are in lesser developed countries. One of the key indicators of world health is demonstrated by life expectancy, and this website displays life expectancy and shows the changes throughout the past 20 years. The countries with the darker shade of blue represent countries that have a longer life expectancy, and the darker shade of red indicates a lower life expectancy. It is already evident that a majority of African countries have a much lower life expectancy, but as I play the video, it will show the changes of this average. You will notice that while there are some improvements to a majority of countries throughout the world, there are actually several African countries that have experienced a drop in life expectancy in the past 20 years. It is also noteworthy to point out that these worldwide improvements are consistent with both developed and developing countries, and many of these developing countries still fall at much lower rates. It may be obvious enough that many of these African countries are still suffering from low life expectancy, and one of the major economic factors of this can be shown through income per person. Gapminder has created a very interesting interactive website graph to illustrate life expectancy and its correlation to income per person. This data goes back to the year 1800, and a majority of the countries worldwide are clustered in similar areas in terms of income. But as the video plays, you will notice a change from this relative equality. As you can already tell, there are a large amount of countries that are breaking apart from the pack and having a general increase to both life expectancy and income per person. The countries in the dark blue represent the African countries, and it is even more evident that lower income per person indicates lower life expectancy. Many of the developing countries, especially from the African continent, still suffer low life expectancy and much lower income person than the rest of the developed world. Now that we have covered how many of these developing countries are in a dire need for health aid and how these countries produce the most cost-effective improvements towards global health, it is important to demonstrate an example of a charity that takes these previous facts into consideration. The Against Malaria Foundation protects children and adults against a disease that kills 1 million people annually and is entirely preventable. This charity provides long-lasting insecticide nets that are placed under the individuals while sleeping, and they only cost $3 and it will last for several years. The Against Malaria Foundation ensures that these nets are distributed and used effectively through this short clip, which demonstrates the distribution and utilization of these simple nets that make a big difference towards the prevention of malaria.